Hey, future medics, and welcome to Anatomy and Physiology. Now, before we dive in, I want to give you a big picture overview of what we're about to dive into and why it matters in the field and not just for taking a test. Now, anatomy and physiology can feel really overwhelming, and I get it. There's a lot of diagrams, body cavities, new words, things you've never even thought of before. And that can feel like a lot, and sometimes it is. But the truth is that A&P is the foundation of patient care. If you don't know that, everything else in EMS just becomes memorization, and it's hard to remember what you don't understand. So think of being a paramedic like being a people mechanic. The mechanic has to know how a car works in order to know what's wrong when it's not working right. And we have to do the exact same thing. On scene, anatomy lets you think instead of just guess. So when a patient says to you that they're having abdominal pain and you see that it's in the right upper quadrant, you should already be thinking to yourself, could this be gallbladder? Could this be their liver? Because those are the things that reside there. Whenever you have a patient with shortness of breath after chest trauma, right, you're already thinking about what is encapsulated in that cavity, thus narrowing down the possibilities of what could even be wrong. This isn't just learning for a test, it's actually developing your clinical thinking. In this part of the syllabus, we're going to build your understanding step by step so the body finally makes sense. Some of the things we're going to go over is how the body is organized, axial versus appendicular skeleton, body cavities and what organs are where, also retroperitoneal organs versus intraperitoneal organs, body systems, the heart. It's the biggest chapter of your book, and for due reason. It is incredibly important, but we'll chip away at it little by little so it won't be so bad. And throughout our journey in these next many videos, where I'm always going to make sure that I tie everything back to EMS so it doesn't feel like you're just learning random knowledge, but why you need to know these things. It makes it easier to remember that way and a little more fun. Every topic will be organized, simple, and clear. And each video will build off of the last one so you're never lost. You don't have to know anything. You'll learn as we go along. If anatomy has ever been difficult for you, that ends here. Stick with me, and video by video, we'll get there. We start simple, we build smart, we don't panic, and we get better. Now, let's go do something big, shall we? I'll see you soon.